And how serious these new developments are?
I think quite serious. And I think for the first time in the press release from the Vatican, they used the phrase critical, that the Pope was in critical condition. So we learned two things today. We learned that he had some form of acute respiratory crisis. They described it as an asthmatic event. Typically, asthma, not in this context, refers to an inflammatory illness that can result in spasm of the airways and difficulty getting air in. But in the context of somebody with bilateral pneumonia, to me it sounds like he had some form of difficulty keeping his oxygen levels up or actively breathing. And in the setting of someone with pneumonia, that can be from something like a mucus plug or some other acute problem. The net result of that is they report that the Pontiff now requires high flow oxygen. The second ominous disclosure is that they described that the Pope's platelet count had dropped, and they described which is called thrombocytopenia. And when one encounters a dropping platelet count in the context of somebody battling pneumonia, it raises the unwelcome specter of sepsis. So the net effect is a significant setback for His Holiness.
And so what course of treatment would you expect doctors would take? Might it involve having to intubate him at this point?
So one of the first things I do when I care for somebody like the Pope, who is almost 90 years old, is establish an advance directive from them and from the family, and understand that whether should the patient's condition deteriorate to requiring intubation, whether that is something that they would want. And we certainly don't know what the Pope's wishes are at this point. But what they did have to do today is change from nasal cannula, which are the ubiquitous prongs that you see in a patient's nose that can deliver about 6 liters of oxygen comfortably to a patient, and increase the percentage of oxygen in the air from about 21%, which is what we see in room air, to 30 to 35%. But that's about as high as you can get with those traditional nasal cannula. And what the medical team caring for Pope Francis did today is place him on a different system called high flow oxygen, in which you can deliver up to 60 liters of flow per minute. And that can raise the amount of inspired oxygen to 100%. The only way to deliver more oxygen would be with intubation. And again, we don't yet know that he is sick enough for that. And we also don't know whether that is something that he would wish for.